Here we go. All right, as people are popping in, good morning, welcome. Happy Wednesday and welcome to yet another community webinar from us at Exon Health. This is going to be an interesting one. I've just realised we haven't got a background, so we're going to just have to look at this screen the whole time, which is absolutely fine. It's going to be a good one. As you joining, it could be good to just drop a 1 in the chat, as you usually do, to let me know that you can hear me. I have had some sound issues this morning. I'm slightly apprehensive about what happens next. But if you could drop a 1 in the chat and let me know that you can hear me. Thank you, Paul. Oh, God, I had a moment there. You saved me. All right. It's been a wild few weeks here at Exon Health. Hopefully you've seen the news and you know about our strategic partnership with Tortoise AI. If you have, you'll know that we've got a sophisticated clinical AI assistant on offer these days. It's available to all GP practices across the UK, regardless of existing telephony provider. And that leads me to happily to my icebreaker for the day, which I will just pop in the chat. I'd really like to know what matters most to you in terms of a clinical scribe for general practice. Something we're seeing everywhere in all of the chats, in all of the trade magazines and stuff, conversations about these scribes. Sharon, you were at an event yesterday, conversations all about scribes. So I'm really keen to understand what's most important to you. There are some suggestions in the chat. If you feel like answering, I'd love to hear it. If not, or just ignore me. Most people do. Awesome. Right. Slight twist on content for you today. The usual bit of housekeeping, though, before we get started. Firstly, to say the call is going to be recorded for prosperity and sharing. So if you need to drop off, don't worry about it. You will get the recording. You're not going to miss a thing. For those that can stick with us, we're going to keep you for about 30 minutes. It's going to be some really good content. So I hope you can stay with us. Second of all, we love the questions. So as we're going, please feel free to drop those into the chat as we go, as they fly into your brain. And I will be keeping an eye on that as we go. So best introduce myself. My name is Lucy Glynn. I'm the community manager here at Exon Health. And with me today, I'm delighted to welcome back the Oracle herself, Sharon Hanley. But slightly more excitingly than that, don't tell Sharon, is Sarah Walker, Operations and Development Manager at Westongrove Partnership. Welcome, Sarah. And thank you for joining us in the hot seat for the first time. It's great to have you here. Right. I'm going to take a bit of a back seat today and hand over to Sharon. All right, no need for celebrations. I'm going to be looking out for questions in the chat, hint, hint. But I suppose the conversation is about, Sarah, your experience at Westongrove Practice and the challenges that you've faced in building, I suppose, what we're terming the intelligent care navigation system. One of Sharon's favourite topics. I'm hoping you get a word in edgeways, but perhaps you could start by setting the scene. Give us a bit of a background about Westongrove and the practice itself, and what patient demand has looked like over the last few years for you.
Yeah, sure. Thank you, Lucy. So Westongrove Partnership, we're a 3-site GP practice based in Buckinghamshire. We're a single practice PCN. In fact, we became a PCN about 24 years ago. Our partners back then saw the advantages of collaboration and merged 3 singular practices together. So we've kind of been through a bit of a PCN journey for many, many years before they became a real thing. We've got just under 34,000 patients, and there's 130 of us in our team.
Amazing. Thanks, Sarah. That's a really good background, and obviously it's very close to our hearts because I actually live there, live around Westongrove, and actually that's my GP practice as well. So just a little secret there. Have been there and known Sarah for a very long time. Hence this opportunity to have a really good conversation about what is good and bad and going on in digital transformation, how we can improve things for patients and also our lovely GPs. So I think first thing first, as at the end of the day, Exon Health have deployed their Surgery Connect product. I know that you had some trials and tribulations and moving towards your telephony and making changes from patient feedback, etc. It'd be really good to hear a bit about your journey for that and sort of where you've ended up with the Surgery Connect products.
Yeah, sure. So we had an old telephone system that in COVID times was on its knees, basically. We were waiting for what was the CCG back then to do an upgrade to telephone systems for practices in the locality, but we felt we couldn't wait. So we upgraded in COVID to help us deal with the demand and the way that things were changing in delivering services, the video consultations, lots more telephone consultations, less face-to-face. The problem was that system, whilst it did the job initially, actually we outgrew it very, very quickly. And it took a long time to be able to get to a point where we were supported to get our upgrade. Having looked at various telephone providers, we felt that Exxon gave us what we needed for our patients, but also for our team. And we went live, middle of December last year. And I have to say, even from day one, it had a great impact. Immediately, we saw that people were using the callback facility straight away. I review our friends and family tests on a monthly basis, and we look at them with the senior management team to make sure that if there's anything that we can learn from it or change processes, we will do. And my friends and family test was full to the brim of complaints about the phone system. People couldn't get through. They were hanging on the line for so long. The poor receptionists that were taking the calls, they would pick up a call and the first thing they would get would be a barrage of abuse from the patients about how long they'd been hanging on the line for. Couldn't get through. I've been on since 8 o'clock and, it was just an absolute nightmare. Go live day, it changed. It just changed completely. And patients really, really loved the callback. And it just saved time for the team as well. When the patients come up immediately and they can just do that security check with them. It just made such a difference to the day-to-day running on the front desk. And I think the thing that sort of instilled the confidence in them was that in the lead up to going live, the support we had from Exxon was fantastic. And everybody that we dealt with had this really calm air about them. And it was all a kind of, don't worry, it'll be fine. And actually it was, don't worry, it'll be fine. It was fine.
That's good. That's great. Oh, that's really nice to get that feedback. I'll make sure I find out who the engineer was and give that back to them as well, Sarah, because that's fantastic news. Are there any features of the Surgery Connect product that you haven't tried yet, that you know of or would like to know more? Because I know there is a webinar about that coming up as well. But are there features that you think?
There's probably a bit, I think. We had a lot of change in a very short amount of time. So we changed our telephone provider, we changed our online consulting tool, and we changed our texting mechanism, all within 6 weeks. So actually the main aim in that period was just to be able to get people to know how to answer a call, make a call, and do all that basic stuff. And we're now in a point where we're starting to get into the nitty-gritty of the system, and starting to look and see, how can we really maximize on the benefits for the patients and for us. And I think one example of how you need to be quite open-minded to managing that change is actually looking at our call flows. We started with one call flow and we're probably on iteration about 9 now, because you get to learn as you go through what works, what doesn't work. And it's been really useful working with you guys to help us manage that as well.
That's great. And I think with the call flows, it is so flexible that actually I know a practice that put in Surgery Connect, but put it in as if it was an analog. And actually it didn't have the impact on the patient calls that they expected, made some changes to the call flow, etc. And it absolutely changed. And as you said, the patient feedback improves. It just gets so much better that they actually can get through the system the way they want to. You mentioned you changed your OC supplier as well. So that was a big shift and a big change in that, and sort of managing how that gets rolled out, how patients are informed about it. Is there anything else you want to tell us about how that actually went, making that big change from one to the other?
Yeah, it was quite huge. We took a long time to decide who we wanted to go with. I hope it's okay. We went with Clinic, so that's okay to share. We probably did about a 6-month project in the lead to go live. We spent a lot of time with our team. We used PTL sessions. We did surveys inside with our team because we wanted to take them on that journey. It was such a massive, massive change. We'd used Ask First before. We'd done a bit of online, we called it our urgent care service, which was kind of the pre-triage thing. So when we went live, I think we were all ready for it. The first week, it's that euphoria moment. It worked. It's okay. We're all still alive. And I think it's fair to say that probably after the first couple of weeks, you get into the real, this is how it is. And it's since then that we've had to start thinking about actually how are we balancing the triage team that are dealing with those calls, how much is actually coming through. We thought that when we went live with Clinic, we would see a massive drop in the phone calls. But actually we didn't, because although we did a huge marketing campaign, it really is Marmite. Patients either love it or they hate it. And there's a cohort that, can't use it. We try to enable our patients as much as we can. We use the Connect form on the phone with the call handlers. We've also put little patient areas in each of our waiting rooms that's got a tablet. So our team can show the patients how to use the online tool using the tablets as a sort of an education piece, which has been useful. But it's just that kind of trying to balance the demand, the stuff that comes through. And I think this is the bit that we're trying to really look to see how we can use the surgery assist to get people away from that online tool, and actually let's help patients help themselves as much as we can, and help our team, because otherwise we're just going to drown.
Yeah, exactly. You took the words right out of my mouth there, is that actually allowing patients to self-serve, because there are so many services out there that we know of, and I'm sure there's plenty more that you and, sort of within your organisation know of, that patients could just go to themselves much easier. And I know I was doing one the other day about, doing a demonstration where a patient's just found out they're pregnant, and in this particular area, you don't need to see a GP anymore. You can go straight to a hospital antenatal service. They type it into the, surgery assist, and it tells them straight away. Whereas the admin staff I was talking to says we still get people wanting to book an appointment with a GP, and some of our untrained staff will just book them in. So they thought that was a fantastic use of the tool. So with Surgery Assist, then you deployed it in December, I think.
We
was it
did.
January.
We deployed.
Yeah.
I think it's just good to note that we kind of went live with a hybrid version the January before, because we had this hideous telephone system and we had to wait so long to go live with Exxon. We worked with you guys to get something going, just to help us, because the demand was so huge. And then obviously once we went live with Exxon, that was the real deployment.
That's right, because we did the hybrid version really to help you with your NHS app uptake, didn't we? That's right. And I mean, what's the uptake been now since we went live with Surgery Assist?
Since we went live, it's just shy of 1,900 new registrations for the NHS app, which is fab.
That's brilliant. So what's your percentage at the moment? I think I saw
around
about,
you might need to have a look at that.
Yeah, I think it's around about 71%. So you're nearly at the target set, 75%. So that's fantastic. So I think we should really try hard to make sure you get there. And hopefully when we enable the AI element as well, that'll help you too. With the clinic issue then, where you've got more coming in than you can actually manage as well. We also know that I've been on a previous webinar where GPs are saying there's too much coming in online, that actually they're not getting much time with the patient. How do you think Surgery Assist can help with that? Because I know at the moment Clinic is front and centre on your website, for example. And what do you think we're going to do to next steps for improving how Surgery Assist is presented to patients?
So what we'd like to do is actually have Surgery Assist be that first port of call. So whereas at the moment on our website, we've got the kind of Start Now button, we'll still have the Start Now button, but rather than going straight through to Clinic, it will have the Surgery interface, the Surgery Assist interface there first. So again, people will be able to use that, and we're hoping signpost them out to the things that they can deal with themselves, that mean that then only the things we need come through.
And actually thinking about that, now we've got the ask a question option in there using the AI. If a patient was to, write something in there that they wanted to be directed to or look for, we can capture that as what we call intent. And on the Surgery Insights dashboard that you've also got access to, we're going to be upgrading that to version 2. That will show you what that intent was, and then we'll also show you what the outcome was, so whether or not they went off into that service. So again, another big measure to see, are we actually impacting change sort of across primary care? So really look forward to working on that with you as well, Sarah. That'd be fantastic. So I kind of think with some of the data as well, with we've noticed from the NHS app is of course prescriptions. So I've been watching your figures, and that has been so massive, the amount of prescriptions that used to come through to you verbally that are now coming through the NHS app. Has that changed much process in the practice, or is it like it's just hidden? Because I know it's gone up by about 200%, the number of scripts coming through to you online. How does that impact you?
It has. It's all a bit of a knock-on effect, really. national insurance coming in, we've had a recruitment freeze, we've had these new systems that are coming in that are meant to be able to save us time. So thinking about the front end, the front desk, we've got 3 sites, we've got 3 reception desks. So we always need to have a person on each site being able to deal with those front of house queries. So as well as that, we're obviously then juggling what the girls and the boys are doing with regard to the telephone calls, the clinic and that sort of thing as well. And now I've completely forgot the question that you asked me. So if you could just say that again, and then I can get
You're
back
going
on
down the
track.
right route there, sort of how it's impacted staff inside the practice, sort of having the ability to move people across to digital. How is it impacting staff really? So you were going down the right routes.
I was going,
So
it's
all
the
the
menopause, guys.
processes.
It's the gift that just keeps on giving. It really is.
That's all of us then.
Yeah.
But from, I suppose, from inside the practice, what do you think the impact's been, even from staff feedback as well?
Sure. So on all 3 sites used to deal with all of their prescription queries that came through. So we had the 3 reception teams. We've also got a dispensary at one of our sites. So at the Wendover branch, the dispensary used to deal with the scripts. Now, seeing the usage of the NHS app go up, what we've been able to do is actually funnel all of the prescription queries through dispensary now. So that's released time on the reception desks. And as I said, with the recruitment freeze, that's then given us a little bit of time that we've been able to deploy to other things like new registrations, looking at the clinic boxes, that sort of stuff. So if we hadn't been able to do that, it's challenging down there on the front desk anyway. They have such a myriad of tasks that they need to do, but just being able to move that one thing, and I think if the NHS app usage hadn't gone up, we wouldn't have been able to do that.
Yeah, that's so true, isn't it? Because I think, and what I've noticed from patients and across all of the sites that we're live in, everybody actually wants to do it digitally. Do you know what I mean? The majority of people that when they see that QR code, they get help to download or come through on the phone. They just think, do you know what? This is so much easier just doing it online. But they just didn't know it before. And because the training is all embedded in Surgery Assist, all the little videos from NHS England, we can see when patients click on those. And we can see that patients are actually using that to educate themselves to be able to, order a script online and use the
And
NHS app.
I think it's also really, really useful that actually when people use the Surgery Assist, if they're not sure how to do it, you can help them. And it's not one of my team that's needing to do that.
Exactly. And I think that was the problem. I had patients say to me when we were doing all our focus groups is that they try to get through to the practice to find out how to do something, but they appreciate they're just adding to the burden. And actually, it's just wasting a lot of everyone's time, but they have sat in queues to try and find out and ultimately not really getting there. So again, just default back to the phone or coming into the surgery. So we've definitely seen impact there. And I'm really proud of that, to see that change in the NHS app. What else do you think? Now we start talking about the sort of
Yeah.
neighbourhood health service that's coming
Yeah.
along. And I'm sort of proud to say that I think we saw this coming along sort of like 2.5, 3 years ago, really, in that how do we help citizens get to organisations that they are available to them, up and down the country, whether it's national, local, whether it's a charity. How do we get patients to them? And that was where we came about with EDAT at the time, now Surgery Assist. But there's more to that, isn't it? Rather than just looking at patients, because patients are people that we look after once they come in to our services. And what we want to try and do is keep people citizens as long as possible. So where do you see Surgery Assist being able to help you sort of manage that development into a neighbourhood health service?
I think it's being able to give patients the option to help themselves before they come to us. So actually having that interface between them and us, thinking about something like all the stuff that our social prescribers do. They do a lot of fantastic work with people that are really needy, but there are also some patients that just need a tip on where to go for something. How can I access my bus pass, for instance? Would you believe it? We get a lot of people that come through clinic about a bus pass. Stop smoking services, all that health and well-being stuff. And I would really like to see Surgery Assist being that interface to signpost patients out to some of those services so that we don't need to get involved. And actually, the patients understanding that they don't need to be poorly or ill to use that service. This is there as a massive directory for them that can actually help them at whatever stage they may be, whether it's sometimes it could be something that's more social rather than, a medical thing. And I think Surgery Assist, particularly when we think about something like Joy, the Joy app, and how that could link in with it as well. And when we have the voice recognition, that'll be amazing.
So that side again is what you're leaning into, that sort of having to do this sort of like the voice agent side of it. So you're sort of saying when people, because again, we want to have equitable services, and capabilities. We don't want to think that everyone's got a mobile phone and text, and we get told all the time not everyone can have a mobile phone or use text, and they do prefer to speak. But now with the AI and all the scribes and sort of voice agents that are coming out and about, and Exxon Health are in the process of developing this. So with that voice agent approach, you could come into the practice and actually speak to a voice agent to carry out many of the things or find out the information that's sitting on Surgery Assist. We'll just be able to relay it back to you in voice as well. So you're saying that would be something that'd be really useful sort of for your practice.
Yeah,
sure. And I suppose it just takes away that sort of receptionist time, doesn't it, spent on reiterating the same conversation, but also using your texting service to text out information. Yeah. So what sort of impact do you think, or are we having on your text services?
And the text services, we've changed our provider with those as well. So this is one of the 3 massive changes that we had. And we use them primarily for lots of appointment direct bookings, that sort of thing. But again, having that Surgery Assist being able to give the patients the information, it brings the cost down on the text that we're sending. And I think for us as a PCN, cost is a big thing. It's a thing for everybody. The costs are going up. We've had things like digital peak-up funding, we've had the CAPE funding. That's enabled us to purchase a lot of these tools that we're using now. Now, if that funding goes and practices need to self-fund, we need to be looking at ways of, saving somewhere to enable us to spend somewhere else. And it's really, really vital that we get that right.
And that's so true. It came up at the event I was at Howbeck yesterday, is that, when things get funded, who's doing the piece of work to show them where it's actually saving the money? Is it really getting that return of investment that it deserves to enable them to then carry on sort of with that piece of tech, whatever they've enabled? And I know when we started with the online consultations and we've got a chart that shows how patients have become more digital, and we can see the uptake in even the online consultations across surgeries where patients didn't use it before, but because they were getting to it from the digital assistant, they started using it. Now, that's great. Return of investment from an ICB point of view, or a practice that's procured it locally, that is fantastic. It is being used. But now we've got to hone down on what's appropriate use of it.
Yeah, absolutely.
And that's where I think the feedback of what's coming through the OC tools, how much of that could we actually get right at the beginning? Hence, you putting the digital assistant under your start here button and sort of replacing it with the clinic one at the moment. That'd be really good. We'll monitor that one. We'll bring that one back to see sort of what the data looks like. I'm really excited to see if that really does have an impact on what comes through. And if we can then let you know where those patients went to, I think that'd be fantastic. I suppose then, so which bit of it, of all of this, do you think you're most proud of? Whether, that's patient, staff, the actual tech itself, which bit do you think as Westongrove want to shout about?
Do you know
and I don't mind whichever one. You don't have to say Surgery Assist.
No. That's
you can say whatever you
like. I think I'd like to really give a shout out to the team. We had a lot of change in a very, very short amount of time. It was Christmas, it was winter, demand was through the roof. We had some tears, we had some dramas. We ate a lot of cake, we ate a lot of chocolate. But they dealt with it, and actually we're in a very different place now to where we were before we went live with any of these products, and even a very different place to where we were sort of 4 weeks down the line. And I think, people say, don't they, it's a journey. It is a journey, because you're always trying to look at what you're using and you're tweaking it, and you're seeing it from the patient's perspective, from your team's perspective. And at the end of the day, we want to make things as best as we can for the patients and as best as we can for the team. And I think how they embraced this and just went with it, I feel immensely proud of them.
Oh, that's lovely, Sarah. And you're saying on a nice big forum, and it'll be on YouTube later, so everyone will get to hear about it. That's lovely, Sarah. Really nice to hear. And I think, just on that, having attended a workforce meeting a few months ago and talking about the impact on, sort of staffing and the cost of recruitment, etc., knowing you've got that happier balance in the across the team, do you think that's having an impact on any recruitment issues you've faced before?
Yeah, I think it's good to have a system that we can tell people about. This is how we run things at the practice. But believe me, guys, this isn't all sparkly. There's a lot of stuff that goes underneath that actually is quite difficult and quite challenging. So please don't think that these systems have been the nirvana and made everything wonderful. They've helped, but you have to keep working with them all the time, to get the best out of them and deal with the knocks when they come along.
Yeah, that's true. And that's what we really wanted it to be, was really sort of like an open discussion about exactly how it impacts practice and staff and patients trying to implement new tech. As you know, did it for years and always felt that it had a bit of an impact and not really the return of investment for anybody on some of it, because it just wasn't that accessible by patients or staff who were using it. And just going back onto staff before we sort of step out, I know we've already got a couple of minutes left, but going forward, Lucy mentioned at the top of the session about the procurement of Tortoise AI, sort of trying to bring in now some real benefits and some releasing some capacity at the GP side. So we're doing lots of work with patients, and we're trying to reduce the demand coming in on the admin staff, which obviously does impact on the clinicians as well. And we're hoping they're able to deliver more proactive care and maybe some, sort of all the recall at admin level. But for GPs, they struggle a lot, obviously, with doing, as we've always known, had a keyboard in front of them. Remember when the computers all came out and everyone complained about GPs facing in a keyboard, well, and not at the patient. And now we've got an opportunity to twist that back around again. And I know when we spoke to Dr. Ash Patel, his ears pricked up at this one. He was like, oh, this one's for me. How do you think you're going to think about taking that forward? What do you think we're going to do? How would you do that in the practice?
Yeah, we are definitely looking at this to see how we can implement it. I think we've learned through the recent projects that we've done, we've talked about this morning, is it takes a lot of time. You need to bring people along with you. You need to look at the warts and all side of things. So I think with this, we are super keen and we really can see the benefits. And it's something that we will be looking at and moving forward with step by step.
Yeah. Oh, that's brilliant. And of course, you've got the Exxon team and the Hanley team as well, behind you all the way on that one. And we're really excited to be able to do that with you. And of course, guys who's listening, you'll be able to come back and see a second session on that, I hope. We won't say when, because as Sarah said, it's got to be done in a real nice structured way and bring people along with you. And we don't want to rush it. We just want to do it right. So we'll have a look at what's available then, sort of using the ambient scribes. We've got voicemail transcription option as well, Sarah. And of course, we've got the voice agent, which we're really trying to sort of build in. But again, I'll let Lucy take over.
I am just going to jump in because there is a question from Sarah that's been burning in the inbox. Is there a timeline for voice assist? I mean, that's not necessarily the name it's been given, but in terms of the voice being added to surgery assist.
Yeah, and that's exactly it. Yeah.
Sorry,
go on, Sarah.
I was going to say we're working very much with Sharon and her team to work out the timeline for us at Westongrove and what's going to work for us with that.
Yeah. And I think how we can make it work, because all of the what we call the FAQs in the back end of the surgery assist at the moment that's running the AI element, it really is just a matter of switching that voice, to be able to read the text, etc., which we are doing with Exxon Health already. So that project has started, and that's what we'll be taking forward with some of our sort of ambassador and our sort of like pilot sites. We're thinking probably Q4, but Tortoise has come in, and it's sort of that whole scribe thing has sort of, taken up our product team a little bit, made them a little bit busy, but it's definitely on the roadmap. So we'll try and do that as soon as possible.
Yeah. Okay. And a question in the Q&A from Renee about cost. Perhaps you could just very quickly give a summary of what the cost is for Surgery Assist.
Oh, for Surgery Assist, so that's a 30 pence per patient per year, and it comes with the Surgery Insights dashboard, which we haven't really covered today, but there are some, I think there's a webinar on it as well, isn't there, Lucy? We could probably make available. But the Insights dashboard is where we want to prove all of what we're putting in is having an impact, because that's where we sort of want to drive it. It's the data that makes the difference, and we want to be able to show that on that Insights dashboard. So whatever activity is going on, telephone, assist, online consultation tool, NHS app, it will be all your intent as well and output as well from patients will be on the Insights dashboard. We want to get your text message usage on there. We'd really like to reduce costs for you and show that in that dashboard as well. So it's 30 pence per patient per year. And again, we kind of feel it's really good value for money because it is the AI version as well. We're not increasing the cost of anything for the AI. That just is a natural development.
Which leads me very nicely into a final question for Sarah. With less than a minute to go, Sarah, I'd love to know if you can summarise in maybe 3 bullet points for anybody that's still sat on the fence with Surgery Assist, why they should go and buy it.
Oh, 3 bullet points. It will really make a difference. That's more than 3. It will really make a difference. And I'm happy to talk to anybody about it, you know, on some one-to-one meetings. Absolutely.
Oh, that's very generous. And very generous to give up your time today as well, Sarah. So thank you ever so much for being here. And that goes for everyone who's joined us on this call. It's been really insightful, actually, and I've really enjoyed the walkthrough, Sarah. So thank you. That is it from us today. We hope you've enjoyed it. Thank you all for your participation. Our next webinar is planned for the 25th of June, so look out for the link because that's going to be a big one. It is going to be about Surgery Intellect, the new scribe, and all about our partnership with Tortoise AI. So we hope you can join us for that and look out for the link. If you'd like any further information on anything we've spoken about today, or you have any pressing issues that we haven't spoken about, pop your ADS code into the chat right now and we'll make sure that somebody reaches out to you directly. We will make the recording available in the next few days to all registered attendees. It's going to have all the relevant links and any answers to any questions that we've not covered here today. We hope to see you all back here again for next month's interaction. In the meantime, on behalf of all of us here at Exon Health and Sarah from Westongrove Practice, have a happy and healthy, what we may. We'll see you all in June for more. Thank you very much for your time.
Thanks, Lucy. Thanks so much, Sarah. Thank you. Bye. Bye all.